Liposuction should not be considered a tool for weight loss. You really do need a good exercise regime and a solid diet and go to the gym. But no matter how much you go to the gym, sometimes there's just those areas you can't get rid of. Men, their outer love handle area. Women, their inner outer thigh. It seems no matter what you do, those areas still persist. We are once again excited to be on the cutting edge of laser liposuction technology and are happy to be the first physician in Canada to now offer SlimLipo. So with traditional liposuction, what you're doing is you're removing fat under pressure. In order to create the pressure, you need to put some fluid inside the area first, and that's called a tumescent solution. So what you do is you put the tumescent solution into the fatty area, you create the pressure, and you use a larger cannula, maybe about 4 millimeters big, to suck the fat out under pressure. At the same time as sucking the fat out under pressure, you're injuring sometimes little blood vessels. This can lead to a fair amount of bruising and some swelling, and therefore a longer recovery time. What the laser technology now does is uses a continuous wave of laser to melt the fat underneath the skin. At the same time as melting the fat, we're tightening little blood vessels. This leads to significantly less bruising, less swelling, and therefore a quicker recovery time. SlimLipo delivers a continuous wavelength of energy through a small little fiber optic tube. Because of the tiny little size of the tube, we're able to make a tiny incision in the skin, not the bigger incision that you used to use with traditional liposuction. One of the greatest benefits now is that cannula is flexible, so we can bend the cannula into certain areas that were very difficult to get with previous liposuction. One of the extra benefits of SlimLipo is we can alter the wavelength that comes out through the machine. Certain wavelengths are better for skin tightening, certain wavelengths are better for fat melting, or we can use a combination of the two. Most people are able to go back to their normal daily life within a day or two afterwards, and certainly back to the gym full out by about 2 weeks.